Hello and welcome, students of Sacred Hearts University. Welcome back to Healthcare Economics MHA 621. It's Dr. D. Want to thank you all for all of your hard work this semester. Congratulations, you are over the halfway point. What I'd like for you to do right now is take your right hand and kind of hold it up right here and then reach around and give yourself a pat on the back. Uh, so good job here. And certainly your grades have reflected that, all of your hard work. But again, congratulations on your robust discussion board postings, your rigorous critical thinking assignments, and all of your meaningful and thoughtful contributions to this course. As we move into Module 3, there is certainly still plenty of work, ahead of us that we want to um, accomplish here over the next 2 weeks, starting with week 5, where you're going to conduct an economic evaluation of a healthcare intervention, health service, or public health initiative. There is a knowledge in week 5, and in that knowledge check, um, that's going to be a self-reflective knowledge check there that will give you feedback automatically. So no work on my part is required there. You basically answer the questions and you'll get that feedback right away. There is a discussion board assignment in week 5 where you will uh, perform your economic analysis. And what you're going to do initially here is you're going to uh, discuss economic evaluations of health interventions. You're going to identify at least one type of an economic evaluation. You're going to describe how it works, what it measures, and the effect that it had on the intervention. Your initial posting should be somewhere around about 150 words, and then your response to classmates should be about 150 words as well. And keep in mind, of course, that anytime you are in an academic environment, you want to make sure that you support all of your work with good uh, in-text citations from scholarly sources or from credible sources, especially in your initial response, not necessarily in your response to classmates, but certainly in your initial response. As we look ahead, though, to week 6, there is an AI SWOT analysis assignment that is going to ask you to just kind of look ahead. And then you're also going to look ahead to the signature assignment, which will be in week 8, and think about how you're going to integrate your topic and choose your topic for your annotated bibliography as well. So that's it for week 5. You've got the knowledge check, you've got the discussion board posting. And so, if you do have time, I would suggest many of you just start moving ahead and looking forward to week 6. And in week 6, oops, yeah. So in week 6, you are going to, again, we're going to continue on with the concepts um, that predict the reaction to policy change and incentives to the external world. So you're going to explore these concepts that predict reactions to, let's say, policy changes or uh, incentives, for example, when they incentivize medical doctors and hospitals to adopt electronic health records for example. So you're going to look at that from an economic perspective here in Module 6 as we close out, or excuse me, module 3 as we close out here in week 6. So you will identify sources for your parameters of your model, and that should include cost, uh, epidemiological information, theoretical rationale, and pay thresholds as well. So by the end of the module, you should be able to apply an economic concept to interpret a supply and demand curve in healthcare, describe strategies on how health systems and hospitals can maximize profit through your analysis, of course, descriptions and models and strategies on price changes or price setting in the healthcare industry. You should be able to explain these concepts that predict reactions to policy changes or external incentives on the health system. You should be able to critically evaluate published data on these policy changes and external incentives, identify sources for model parameters, including economic related costs, epidemiological and clinical data, and then finally conduct the SWOT analysis. And this is an AI SWOT analysis where you will analyze the strength, weaknesses, and opportunities of using AI in strategic, or excuse me, in economic decision making. Okay, so in week 6, you have the knowledge check. And the knowledge check is really going to check your knowledge of the principles of a critical appraisal of healthcare economics. That's something that you're going to build your skills up here, starting in Module 3, particularly in week 6, as we look forward to that final exam, or excuse me, signature assignment in week 8. Your discussion board, I want you to do an analysis on Drummond's checklist for assessing economic evaluations. You need to be very familiar with these tools so you can adequately vet which economic evaluation that you're going to choose based on your chosen topic as well. So, your initial posting for assessing Drummond's checklist for economic evaluations, you're going to uh, expand or explain the different criteria that Drummond's checklist uses, how you would use it to assess an economic evaluation, and then the checklist itself for assessing economic evaluations. That initial post again needs to be somewhere around 150 words. It's okay if it's a little longer, but you certainly don't want it to be shorter than 100 words. You do want the required academic rigor, and again, it's a academic environment, so you always want to incorporate not only the analysis of Drummond that you'll use in an in-text citation, but perhaps support from the textbook or a peer-reviewed journal article or some credible reference there that you also want to integrate through in-text citations into your discussion board posting. The major assignment here in week 6 is the SWOT analysis. And in that assignment, you're really going to explore the strengths, weaknesses, opportunities, and threats of using generative AI in economic research and decision making. And so, part of what you're going to do here is you're going to use an exercise from the book. You're going to create some graphs using AI, And then after that, you will develop recommendations on how healthcare organizations and managers, decision makers for that model, can use generative AI in their research and in their decision making process. So, the first part in this two-part assignment is to complete the exercise 7.11 on page 131 of Lee's Economics for Healthcare Managers, 5th edition. And I'm asking you to complete that exercise verbatim. So don't change any of the inputs or the outputs. Uh, just use those numbers verbatim in your analysis. Then, after you solve the economic equation, if you will, step two will be to use a generative AI tool to graph the relationship between the price and the total quantity, where you're going to put the total quantity on the horizon axis. Step three of part one, you can use Exhibit 7.1 or Exhibit 7.2 on pages 121 and 124, respectively, as a visual reference. And I believe one of those, I believe it's 7.2, is actually a mirror image of what you're doing with 7.1, except it has different numbers, obviously. Then you're going to submit a screenshot of your AI output, i.e., this is the graph where you graph those two points there. And then you're going to describe the process of how the inputs were built to generate your graph. And I've got a couple of links to some free AI tools, including Graph Maker. If you have access to another AI tool, that's fine. I can say that many of these AI tools may also incorporate Microsoft Excel, and that's fine too. So that's step one. Just to recap the that's part one. So just to recap the four parts of step one, you're going to complete exercise 7.11 on page 131 of the textbook. You're going to use one of the links that I provided to graph the relationship between the price and total quantity from assignment 7.1. You can use um, Exhibit 7.1 or 7.2 as a visual reference for how the output should look, your AI output graph should look. And then you're going to submit a screenshot of that AI output with a description of how the inputs were built, and how it ultimately produced the output. So that's part one. Under part two, you're going to now analyze the strengths, weaknesses, opportunities, and threats of using the AI tool for economic research or economic decision making. And so your SWOT analysis should include how using the AI tool enhance your experience, your learning experience, perhaps the tacit knowledge that you took away. You can define what that looks like for you. Step two, what advice would you give a manager, a decision maker, an executive on using AI in order to help them make decisions? I've got a couple links there with some SWOT analysis, examples of SWOT analysis. But at the end of the day, your submission should include four things. And this encompasses both part one and two. So at the end of this assignment, there are four points that you should have in your deliverable. First point should be a screenshot of your graph that was generated in the AI tool, along with that description. Part two should be an actual SWOT analysis. Step three should be point 4, excuse me, point 3. I'm using all kinds of nomenclature here. I apologize. Point 3, the SWOT analysis should include your brief introduction, an analysis of each of your quadrants, a summary conclusion, and a reference page. Your entire submission should be between 4 to 6 pages with a 6 page maximum. And that does include the AI graph and the SWOT analysis. So you've got to be very concise and very succinct with what you want to do, considering you only have 6 pages and two of them are already dedicated for your screenshot and also for the graft itself of your SWOT analysis. And then just as a reminder, if you will, submit your work in MS Word. It's easier for me to give you your feedback. And this is an academic environment, so you always want to integrate evidence from the textbook, evidence from the tools that you're using, evidence from credible sources into all of your work, particularly that SWOT analysis and the face of your SWOT analysis. If you are using paraphrase content, you must have the author and the date listed on the face of your SWOT analysis. Okay, so I think that is about it for week 8. Excuse me, week 6. I'm just all over the place. And module 3. And again, module 3 would include week 5 and week 6. Okay, I think that is enough for now. Thank you very much for listening. Please reach out to me like you have done in the past with any question, comments, or concerns. For those of you that want to connect with me on office hours, please email me. I'd be more than happy to set up a Zoom session with you. Bye for now.